So for this first part of this video, I'm going to be showing you the posterior glide of the humerus and then writing the scapular mobility. So we will begin. Hi Catherine, my name is Cody, I'm your student PT today. Okay, the first thing I just want to look at and show is going to be, we're going to just look at basically your joint mobility with your shoulder, okay, and its ability to kind of slide backwards as you kind of raise up and up, right? Okay, so I'm going to have you have your arms right to your side, just nice and relaxed, alright? Okay, and here in a second, I'm going to hold your arm up, okay, and apply a little bit of pressure on top of the shoulder, just kind of feeling for your joint mobility there, is that alright? Okay, so I'm going to grab this guy, kind of going to cover it right in there, and then my arm, now I just want you to completely relax, okay? Good. Now as I bring you up, just slightly push back. I can just push posteriorly, sorry, to get that posterior glide, right? She's feeling like not any hypermobility, she's not super stiff, so she feels good here. And also, this is also part of pushing the flexion as we do a mobilization. That would be both posterior and lateral. We will compare it bilaterally for this one as well. So I'm going to go like this one, good. This one right here. Nice and relaxed. Okay, and I'm just going to a little bit downward pressure right here. Again, same thing here. Not overly stiff, not super lax, or anything like that. Let's say right within good normal range. And then next, I'm going to have you roll on your side facing me. Okay, for this next one, we're going to look at scapular joint mobility. So with this, we'll take her into retraction, protraction, elevation, depression, and then upward and downward rotation. You can also look at anterior, posterior tilting, and that kind of stuff. Okay, so here, the second basic is I just want you to relax, and we kind of brace your arm, hold like support right here at the top of the shoulder, and then kind of move your scapula around, just looking how the joint's kind of moving. Is that alright? Okay, so I'm going to take this guy. I'm going to come right under here. Now you can just relax right there. Okay, now I can like her inferior borders right here. I can cusp that right there. Okay, and then I can come here, and I can support right here. And now what we can do is we can kind of grasp the whole scapula, and we can push it into retraction, and then protraction. We can right there back in the midline, and then again we can come into elevation and then depression. Okay, we can even go into a little bit of like anterior and posterior tilt. And then lastly, what we can do is we can come into a little bit of upward rotation and back down. Hit that a couple. We're running. Okay. And then for that first one, that was just a grade 1. So a grade 2 posterior glide would just be just like this. Okay, we would support here. Boom, grabbing it onto the arm. And then so again, a grade 1 would just be that slight pressure, not putting any tension on the joint capsule necessarily. And then again, with a grade 2, just be a little bit farther, trying to just activate that healing process and synovial fluid, getting fluid into the area. Grade 3 would again start to press a little bit more, trying to start to stretch that posterior capsule a little bit. And then finally at grade 4 would be just a little bit more pressure, trying to get a little tension on the capsule itself so we can create some sort of change. Okay. And for our first special test, what we're going to do is the first one is going to be the clunk test of my choice. Okay, so I'm going to have you pick up your head just slightly real quick so I can move this. I'm just going to move to the side right here and lay that back down. Okay, so with this, what I'm going to have her do is I'm going to have her bring her arm up overhead for me, just like that. Boom, and what I will do is I will kind of just hold and support. I'm going to have you just completely relax right there. I can place my knuckles right underneath that shoulder. And what I'm going to do is I'm going to apply an anterior force while I put her into external rotation, which is in a positive sign. We'd feel like a clunking feeling through the shoulder as we do that. So my knuckle is just right underneath there. As I push anteriorly, I can also externally rotate, just like that. Push anteriorly and externally rotate. Boom. Sorry, that was push anteriorly, externally rotate, just like that. Boom. No clunk, no clicks, nothing like that. So for this next one, we're performing a sulcus sign. So the first one that we'll do in supine while she's here, then we'll bring her up to see if you can check there too. Okay, so what I'm gonna do is I'm gonna take her into about 20 degrees of abduction in this position, and all I'm gonna do is I'm gonna give a little inferior force here. Again, looking if this was a positive sign, there'd be a gapping or like a sulcus that would appear right here between the acromion and the head of the humerus, and we measure that. But as you see, there's nothing appearing there, so that would be normal. Okay, and then I'm gonna have you sit up on the edge of the table just right here. Good. And then right here, we can do that same exact thing. What we can do is just have her nice and relaxed. Okay, just relax for me, okay? And all I can do is just give that inferior glide to the humerus. And then again, no gapping, but if that was a positive test, then we would see that gapping between the acromion and the humerus. And then lastly, we can go into the Neers test, which is going to be right here. And basically what I'm gonna have her do is I'm gonna support you just in the back of the scapula. Okay, I'm kinda gonna hold your scapula here. Okay, I'm gonna have you come all the way overhead and flexion as high as you can for me right now, okay? Good, like right there, hold that. Okay, I'm gonna support her back here. I'm gonna take my hand right here, now just relax, okay? I'm gonna kind of put a good amount of force onto this scapula so we can brunt it, and if this would be looking for neural impingement, I'm giving a little bit of overpressure here, and if that was a positive sign, right, those symptoms would come on and have some sort of radiation.